People lump these two together like they're the same disease with different severity. Type 1, the serious one. Type 2, the one you did to yourself. That's not just insensitive, it's factually backwards in ways that hurt both groups. But if you don't know which mechanism you're actually dealing with, you can't know what's actually possible for you. These aren't two versions of one disease. They're two different diseases that happen to share a name. Watch this video. I put it together to show you the difference.
Type 1 diabetes is an autoimmune condition. The immune system mistakenly identifies the insulin-producing beta cells inside the pancreas as a threat and destroys them, over time reducing insulin production to a trickle or to nothing at all. Type 2 diabetes starts differently. The pancreas is usually still making insulin, often more than usual, at least at first, but the body's cells have become resistant to it, so glucose has trouble getting where it needs to go even with insulin present.
Type 2 accounts for roughly 90 to 95% of diagnosed diabetes cases. Type 1 and related autoimmune forms make up most of the remainder. Onset age is where a lot of the public confusion comes from. Type 1 is often diagnosed in childhood or young adulthood, which is part of why it still gets nicknamed juvenile diabetes, but it can develop at any age. There's also a slower developing autoimmune form called LADA, latent autoimmune diabetes in adults, that shows up later in life and gets misdiagnosed as type 2 more often than most people realize, because the antibody testing that would catch it isn't always run.
Given how much these two conditions get confused, especially at adult onset, it's worth knowing how doctors actually distinguish them, because getting this right changes the entire treatment picture. Two tests do most of the work. A C-peptide test measures a byproduct released whenever the body produces its own insulin. Low C-peptide points toward type 1 or advanced type 2 beta cell loss, while normal or high C-peptide points toward classic insulin-resistant type 2. An autoantibody panel checks for specific markers, GAD65, IA2, ZNT8, and insulin autoantibodies that show up when the immune system is actively attacking beta cells, confirming an autoimmune process behind type 1 or LADA. Neither test is exotic or expensive, but they're not always ordered, especially for an adult who presents with type 2's typical picture, which is exactly how LADA slips through misdiagnosed for years. If you were diagnosed with type 2 as an adult, but medication hasn't controlled things the way it usually does, or if you've stayed lean and still developed diabetes, asking your doctor about these two tests is a reasonable, low-cost way to confirm which disease you're actually managing before building a long-term plan around the wrong one. This isn't about self-diagnosing from a video, it's about knowing which two tests exist so you can have an informed conversation with your own doctor, particularly if your case doesn't fit the typical pattern for the diagnosis you were given. This is the part that matters most practically. Type 2's core problem, insulin resistance, is largely driven by mechanisms this channel covers constantly: ectopic fat inside muscle and liver cells, the Randle cycle, ceramide formation from saturated fat. Those are mechanisms a whole food, plant-based, low-fat approach directly targets, which is why meaningful numbers of people with type 2 are able to bring blood sugar into a normal range and come off medication entirely. Type 1 is a different problem at the root. Diet doesn't regenerate destroyed beta cells, and no dietary approach, this one included, restores the body's own insulin production once it's gone. Insulin remains medically necessary for type 1. Full stop. Type 2 doesn't appear overnight, and understanding how it develops helps explain some of the confusion between the two conditions. In the earliest stage, cells become progressively more resistant to insulin, often driven by the ectopic fat and Randle cycle mechanisms covered elsewhere on this channel.
The pancreas compensates by producing more insulin than normal, a state called hyperinsulinemia, which can keep blood sugar looking normal for years, even while the underlying resistance is worsening. Eventually, in a meaningful share of people with long-standing type 2, the beta cells that have been working overtime to compensate start to lose function from the sustained strain, not from an immune attack, but from years of overproduction. That's why some people with type 2 eventually need insulin therapy too, which adds to the public confusion. It looks similar to type 1's insulin dependence, but arrives through a completely different mechanism: beta cell fatigue from compensating, not beta cell destruction by the immune system.
This distinction matters because a type 2 patient who reaches this stage still has a different disease process than type 1, even while using the same medication. The insulin resistance that got them there is still the mechanism most responsive to dietary change, even if some beta cell capacity has been permanently lost along the way. This progression also explains why earlier intervention tends to produce better results than intervention decades in. Reversing insulin resistance while beta cells are still largely intact preserves more of what's recoverable than trying to restore function after years of compensatory strain have already taken a toll.
None of this means diet is irrelevant for type 1. Insulin resistance isn't exclusive to type 2. A person with type 1 can also develop insulin resistance on top of their autoimmune condition, sometimes called double diabetes. When that resistance improves, the insulin dose needed to manage the same glucose load often drops, time and range improves, and the day-to-day volatility that makes type 1 exhausting to manage often eases. So the honest claim for type 1 isn't diet reverses this. It's diet can make the insulin you still need work better and reduce how much of it you need, a meaningfully different but still real benefit.
Collapsing these into one conversation does a disservice to both groups. Tell someone with type 2 that insulin is their only option, and they may never learn that a change in mechanism, not just medication, was available to them. Tell someone with type 1 that they just need to eat better, and you've implied their condition is a lifestyle failure, when it's an autoimmune process they didn't cause and diet alone cannot cure. Precision about which condition you're actually talking about isn't a technicality. It changes what's achievable, and it changes what someone should and shouldn't be blamed for.
Whichever one you're living with, the mechanism matters more than the label people slap on it. If insulin resistance is part of your picture, and for most people with type 2 diabetes, and plenty of people with type 1, including myself, a whole food, plant-based, low-fat approach goes directly after that. That's part of my own story. My insulin needs dropped from 83 units a day, that was my average, to 35 once I understood which mechanism I was actually fighting. If you're interested in more information about diabetes, click the link below. That's not managing your diabetes, that's dominating it.